So, you guys remember, we're going to keep it on mute right now until we get started, and then we're going to pop it off mute and then answer, but we're going to have a respectable amount of time. I'm going to flip screens and I'm going to get started. Can anybody see anything other than somebody's name right now?
No.
Okay. What about now?
I just see you.
Cool. So if I look crooked or cross-eyed, it's because I'm not paying attention to what you guys are looking at. I'm paying attention to what I'm looking at. So apologies on my behalf if that's the thing. Make all the memes in the world. So let's talk about some very simple body mechanics. Tell me about what this means. What is this called? This action. Is it? What am I holding? I'm holding a can of what?
Soup.
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 This is can.
Supination.
Supination. Good. And this is?
Pronation.
Pronation.
Good. Perfect. So would this be extension or would this be flexion?
Extension.
Extension.
Very good. And this?
Flexion.
Flexion.
Very good. Perfect. What type of rotation is this?
Circumduct. No.
Again, you ready?
External rotation.
Internal rotation. Yeah.
Internal.
Yeah. What about this?
External rotation.
External rotation. What about this?
External rotation, abduction.
Of what?
Of your shoulder. Of your shoulder.
Yes. Bonus question. Who knows the name of that joint right here?
Humerus.
Nope. Glenohumeral. Close.
Myoclavicular.
Close. Beautiful. Love it. All right. So let's talk about abnormal gaits. What is an abnormal gait?
Risk for falling. Risk for falling.
Okay. Yeah, for sure. Because they're not walking steady. So give me some examples of
Limping.
Yeah.
Shuffling your feet,
Unsteady gait.
small
Dragging your feet.
Shuffling.
Shuffling of feet.
leaning forward while walking.
Oh my gosh, yes, that's creepy. Yeah. It's not creepy because some people can't help it, but to watch the action is so abnormal that they're walking like this. Yeah, for sure. Sometimes they stand on their tippy toes and walk on their tippy toes the whole time. For sure. Those would be considered abnormal postures. Good. Tell me about kyphosis.
Hunchback.
It's your curvature of your T-spine as well.
Very good. Very good. Curvature of thoracic spine. If I'm standing up and this is my head, oh man, my fingers can't do that. I would have the traditional hunch over back. Hi, I have a hunchback. And it's more like this, right? Okay, so then what is it if it were my lumbar spine?
Lordosis.
Lordosis. And then how is that curvature different?
Inward.
Yeah, for sure, for sure. Okay. Tell me about scoliosis.
Your spine is pretty much making a curve into a S or C shape. It affects the patient's lungs. And we use it by using a measuring tape of 10 degrees or more.
Yowza. I mean, if I had a grape job sticker, right, to give you, like you would have gotten it. That was great. How about let me see. Let's move to vitamins. Okay. So tell me about a vitamin deficiency that causes flaky eczema-like patches.
Your fatty acid deficiency,
What is it?
fatty acid.
Yes, fatty acid. Very good. Now, what if I told you that you had a specific deficiency that was causing hair falling out, incredibly brittle?
So wouldn't that be zinc, fatty acids, and protein altogether?
It would. Very good. Very, very good. Tell me what an iron deficiency would do to a person.
There are multiple bruises on them.
Color. Pale.
And homeostasis problems,
Yeah.
right?
Tell me what would happen to my capillary refill. What's the expectation?
It'll be sluggish.
For sure. How
Greater than
So it would
3
be more than
seconds.
5
Greater than 3 seconds.
seconds.
More than
Oh,
3
3 seconds, sorry.
more than 3 seconds, yeah, because remember, it's just on a station of 3. Would it be 5? Presumably, absolutely. I would definitely expect that, considering, or up to, but 3 is just the tape of measures where we use things. Bonus question about iron deficiency. What about another type of iron deficiency anemia? What is it relatable to as far as a vitamin deficiency?
Pernicious.
The B12.
Oh my gosh, yes.
Pernicious. OB12.
So a B12 deficiency looks very, very similar in a lot of ways to, a traditional iron deficiency. However, they're missing something in their body. Does anybody know? Okay.
Folate.
We'll talk about that later. That's not a testable item. I was just kind of curious. So you're okay. We'll talk about that next time around, because that needs to be added to what you guys are learning for the next exam. I just wanted to see if anyone knew. All right. So there's a reason I'm asking. Don't worry about it. So let me see. Tell me about BMI. What is a BMI?
It's a height weight ratio.
Index.
Yeah, for sure. And it's a height to weight ratio. Does anyone happen to know it?
So for your ideal goal is 25, but your normal weight would be 18.5 to 24.9, but that fluctuates with today's society. Anything over 30 or greater is considered obese.
All right. And of all of that, you're going to be so ready for Med Surg 1 and 2. So as long as we understand what a BMI represents and what the standard looks like what the average would be, as well as what would be the higher end of things, right? Because if you know the baseline, you know the lower end. So the middle ground really doesn't matter much, believe it or not. It's the higher number that matters. As long as you got those, we're good. All right. If I start to have bruises everywhere, what am I deficient in?
C and K.
CNK.
C and K. Yes. Does anybody have an easy way to remember C and K and multiple bruises? Can anyone create a hack on the spot?
Valentine.
I used the frosted Kellogg's because the cereal's box is blue, and I think a cereal on the Kellogg's. That's just me though.
Nice. I thought immediately carrots, because they make your eyes strong. Wait for it. And K for carrots as well, because they're as hard as a diamond and hard things create bruises.
I
That
was thinking about,
my
oh,
thought.
sorry,
No, go.
Chris Brown and Carucci.
What is it again? Say it slower. Sorry, there's a little bit of a
Chris
muffle.
Brown and Carucci. Because,
Okay.
Chris Brown was abusive, so bruises.
Oh,
and
boy.
then Carucci.
That was,
Just,
oh boy. Yeah. Well, that was efficient thought. And perhaps we should have found a lighter way of putting that. But that was very creative. So bonus points. All right. I'm glad everyone has a hack. It's nice to make hacks because it helps us get through these exams. So make them for yourself. Now, there's one person I want to address this with who has literally been asking me this question the entire time. So I'm going to ask them the same question. So if your initials are CS, and I know you're there, Mr. PC, can you do me a huge favor? I'm going to ask you a question and you tell me the answer. You ready?
Sure.
On the spot you go.
Okay.
I am going to look at my patient's abdomen. I'm going
Abdominal aorta.
no,
Oh,
stop, stop,
no.
stop. I'm going to listen or auscultate a person's belly because I'm doing an abdominal assessment. In what order should I proceed from auscultation? Or do I do it? How do I do it? Do I do it inspection, auscultation? What are my other options, guys?
Palpation.
And
Inspection, auscultation, palpation,
That's it.
percussion.
and percussion. Yeah, but you
No
know, I
percussion.
don't really do that for the abdomen. So I would listen first. I would auscultate.
Okay. So remember, inspections there, and all you do is look. So you want to inspect first.
Look, listen, and feel.
You auscultate second. Then you palpate and make sure that palpation, if you are palpating before auscultating, it might alter the bowel sound. So that's why in the abdomen, we change the way we do it. Does that make sense?
Yes.
Okay. So if you palpate before you auscultate, specific to the bowel, it may alter the bowel sounds that you have. So you may have had still an ileus in your belly, right? And peristalsis is all but seized. It's done. And because you've done that first, you've wiggled things around, and then you might get a sound that wasn't meant to be there. Does everyone understand that?
Yes.
Okay.
Yes.
I think I ran it to the ground like I was supposed to, so that's good. All right. So I'm going to listen to a patient's belly again. How do I need to have them lying?
Supine.
Okay. Anyone else?
I
All
would
right.
say flat.
Flat? Okay.
Mhm.
Okay. So flat is also known as supine. So let's go over that really quick. All right. So supine would be if this were, well, this would be better. If this were my head, effectively, and these are my fingers and those are my feet. This is weird. Okay, whatever, we're doing this. If this was how things were, and I'm not flipping a gang sign, right? This is laying supine. This would be laying prone. Now, if I were laying prone and I was doing an assessment on a patient, what would be a good opportunity? Like, what could I do to the body to test something that is on a prone position?
Hyperextension.
Hyperextension of the arms and the legs. Good, because I can't hyperextend them if I'm laying on my back. That doesn't make any sense. Perfect. Smart, smart cookies. All right, let's talk about the belly again. When I'm looking at the person who is laying supine, which is flat on their back, and I'm looking at the abdomen, what am I looking for specifically during the inspection process only?
If
What's something that's going to freak me out if I see it?
a
Your
pulse,
aneurysm. The pulse. The
abdominal aorta.
Yeah, that one. That
Good.
one. That-
That one, yes. Yeah, the AAA. It's not a good day. Okay, that's the rhyme for that. So you're going to look for thump, 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 thump. Where is that thumping going to be located?
It's going to be located in the
In between umbilical and
on top
pelvic.
of the umbilicus and
Between the umbilicus and pubis.
Perfect. So your area is about yay big. All right. And if they're laying flat and it's thumping and you could see it and you're doing this number, that's not a good sign. That's bad. You need to jump on that immediately. Not don't jump on it literally. That would go bad, even worse. Funny how
They were going to surgery, right? Pretty soon.
at that point we're not I'm getting scans quickly. Yeah, if not yeah. For sure. I've rarely seen a case where we didn't. All right, so let me tell you about some belly stuff and let me know if it's okay. There is a convex umbilicus.
So it's a poked out belly button.
Yes. Very good. So is that normal or abnormal?
It's normal because, well, I don't know.
Normal.
That's a hit or miss because,
It's normal.
yeah, some people have outies.
Some people have atoms. It's normal. We're good with that. Unless it's like, purple or
Like a hernia or something.
yeah. Unless it's like that, obviously. All right. What if skin is taut and there is silver striae?
That's normal.
That's normal.
Cool. Well, what word did I say that might not be such a good word?
Striae. No,
Stri-
silver.
Silver striae is fine. I said the word taut. Yeah. Taut's
Oh,
not a good word. All right. So if it's silver striae only, cool. If I say the word taut and then I add in engorged abdominal veins.
ooh,
That's abnormal.
Yeah. Yeah. If it's distended, if it's taut, if it's yellow tinged, if you have engorged veins, bonus question, what's that called?
that's
Kaput medusa.
no.
Who said it?
I
Who?
did.
Yes. Perfect. Kaput medusae. There's or cap.
Sorry.
However you want to say it is fine. So yeah, that's genuinely brilliant. Thank you. That's wonderful. So yes, absolutely. So what if I say umbilicus is located centrally?
Central. So
It's normal.
That's normal.
Yeah.
midline, yeah.
Yeah.
Technically structured.
Say skin is lighter on the upper arms and the upper legs.
That's normal
Well,
because it
because
doesn't get much
less
sun.
exposure to the sun.
Yeah, it's an old farmertan. Cool. All right. Sorry, I'm bumping. Okay. When we are inspecting, auscultating, palpating, percussing, and we are specifically on the abdomen, what do we need to make sure that we do when we are percussing and palpating? What do we need to go and make sure that we measure?
Listen for at least 5 minutes for bowel sounds.
Okay, cool. What else?
You're measuring
Asymmetry.
distance, so you want even respirations, well, even slow respiration. So you're measuring that.
I am measuring even slow respirations when I am listening to lung fields, correct? This is specific to the abdomen.
Oh,
So what do I need to make sure I'm listening to specific to the abdomen? I'm palpating specific to the abdomen.
Bowel sound.
In what?
Oh, in the quadrants.
Yes. Yes. You have to do all 4 quadrants.
Yeah.
Perfect. So when I'm percussing, I'm palpating, I'm doing those things. You got to hit all 4 quadrants for sure, especially when you're auscultating. Unless what's the one caveat where we just listen to one section, and as soon as we hear what we hear, we're done.
We don't hear any vowel sound.
Because
right?
what does that imply?
Perforated bowel? Or
obstruction.
no, obstruction or like a ileus?
Yeah, for sure. It could be either or in some cases, most definitely. So perfect. Perfect, perfect. In that case, we would just go grab somebody. All right. We're going to play the game. Tell me where pulmonic is located.
The second second intercostal space on the left side.
Okay, good. Is it midclavicular? Is it sternal border?
Sternal border.
It's the sternal border.
So it is second intercostal space to the left of the sternal border. Perfect. Okay. Give me herbs.
Herb's point is the third intercostal space. Mid clavicular. Oh
Left
no,
of the sternal.
left of the sternal border.
Yes, left of the sternal border. Third space. Perfect. All right, let's do aortic.
Aortic is the
is second
second
intercostal
intercostal
space.
space right of the sternal border.
All right, let's do mitral.
Mitral is the fifth intercostal space.
At the midclavicular line.
Okay, I had someone ask me for a hack now that I just thought of that. And I hope I have a pen so I don't have to get up. Otherwise, I'm just gonna, well, we're just gonna have to draw it the old school way. Okay, watch. Someone said, how can I remember that mitral is fifth? You ready? Draw an M. And how many points do you get if you were to draw dots? One here, one here, one here, one here, one here. Literally makes an M. It's 5 points. There's your hack.
Did I
Ta-da!
say 4 or 5?
It's
You-
5.
It's 5. Yep, you're good. And then tricuspid.
Your
Fourth.
tricuspid is the fourth intercostal space at the left of the sternal border.
Perfect.
Mid. Yeah.
Oh, oh. What was that about midclavicular?
Nothing.
Which one's midclavicular?
Mitral.
Mitral. That's the only one, yeah, because that's right.
Remember, mitral, midclavicular. They both start with an M. See, it's fun. It's a fun game. Oh, midclavicular. 5 syllables. Huh? Okay, there you go. Isn't that fun? That was all 5, right? Yep, we got them all. All right, let's talk. Tell me about heart sounds. What are some heart sounds that are not good heart sounds? What does that sound?
That is a
That's
it's-
3 and 4.
Don't raspy whooshing. Those are heart murmurs.
yeah, murmur, sorry.
Heart murmur. Yes. Again, I will do it. That's a heart murmur. So let's get a little crazy with this. All right. What does it sound like if it is that sound, which is like harsh, raspy, whooshing, blooshing? I don't know how to define that, whatever. And it's after the second or the S2 sound. What kind of murmur is it?
Diastolic murmur.
Diastolic murmur. Perfect. Now, what if it's after S1?
Systolic murmur.
So smart. You're smart. I love it. If I hear a third sound that sounds like the word Kentucky, what kind of sound is that?
Heart failure.
I'm sorry, what?
That's a S3.
Is an S3. Yes.
Okay.
Both of those answers are correct. What is our hack for an S3?
Kentucky.
Kentucky, 3 syllables. Perfect.
Yep.
And then if we heard an S4, what would be our hack for the S4?
Tennessee.
Tennessee.
Tennessee. It actually has 4 syllables. All right, cool. Love it. So we've just established that S1 is considered what?
Systolic murmur.
Systole.
Beginning of
Systole.
system.
And if there is a murmur, then a systolic murmur, yes. And then S2 is considered what?
Dias.
Beginning of diastole.
Diastole or diastole. I've heard
Yeah.
both.
I didn't know how to say it. Yeah, dias.
Fine, diastole, diastole. I've heard both, honestly, from cardiologists, believe it or not. So it doesn't matter. Tell me what this sound represents. It's kind of a gritty, grindy, sandpapery kind of sound. What is that?
Your pearl
That's
rub.
whenever you're putting the stethoscope
pearl
against
rub.
the lungs.
So it can make that sound if you're on someone's clothes. That's accurate. Specifically, if this were a heart sound, what would it be?
It's a pearl rub. It's an emergency.
It is a friction rub. It is a big deal. It is a bad day, right? You want to talk about pain? It is an incredible amount of pain because it's being scratched like sandpaper. Very painful. All right. If I were to tell you, name this pulse, what would you get?
Brachial. Excuse me. Brachial.
Brachial. Cool. What about this one?
Temporalis.
Temporal.
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 Very good. What if it's behind my knee?
Calcaneal.
Popliteal.
Popliteal.
Sorry.
Remember, pop in my knee. Popliteal. Good. What if it were on the top of my foot?
Dorsalis.
Dorsal.
Medius.
What if it were if I pinch my Achilles?
Posterior tibial.
Beautiful.
Yeah, Tom, Dick, and Harry. Yes.
What if it were right next to my pinky, but at my wrist line?
Ulnar.
Ulnar. But is that where it's located? An artery line?
No.
It's located.
That is.
Ulnar.
Oh, that's
Going down the ski slope, man.
Oh yeah, radial.
Yeah, it's rad, dude. Good job.
Yeah.
Cool. Ta-dum, boom, 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 boom. Tell me what BLS stands for.
Basic life support.
Beautiful. And what is that in reference to?
Life-saving techniques.
Resuscitation.
Specifically,
technique.
what type of resuscitation?
Cardiopulmonary.
Chest compressions.
Pulmonary resuscitation. Perfect. What do you use if you need to go get emergency aid by using a machine to regulate and monitor heart rhythms?
AED.
You said say that again in the beginning?
So when there's an emergency and you need to monitor someone's heart and it's an emergent situation outside of a hospital, what do we need to get?
CPR.
AED.
AED.
Yeah, very good. Very good. What type of machine is an AED exactly?
It's a defibrillator.
All right, Latin. We ready? Let's say, tell me what melanoma is.
A malignant tumor.
Okay.
In depth.
Black pigmentation. Tumor.
How do you spell it?
MELO. Wait, MELANOMA.
Very good. I decided that with Latin, we're going to make it one step farther. We're going to make sure we have it spelled correctly. Okay. We need to focus on that. It's very important because if you're off by even a few letters, it can mean something completely different. So we need to focus on that a little bit more. So I'm going to challenge you just a bit. You'll be okay. Tell me what it means to have tinnitus.
It's ringing in the ears from Lasix being pushed too fast.
Okay. Or for other reasons. But yeah, for sure, for sure. Tell me what alopecia is.
Hair loss,
Bald hair.
no follicle, hair follicle.
Okay. Okay. Tell me what ototoxicity is.
Medication that's
Ototoxicity is
causing your
whenever you
ears.
push Lasix and you can become deaf from pushing it too fast.
Good. Very good. Tell me what hemiplegia means.
Paralysis.
One side, halfway, half side.
Half side. Very good. Hemi. Very good. All right. Let's do a little neurobrain. All right. Let's say I have a degenerative disorder in my brain. And while we're going down that information superhighway, we are losing that myelin sheath as we go along. What is the name of that condition?
Is that a TB? No,
Myelin sheath.
that's flu.
Can you say that again?
Myelin sheath. That's
Myelin sheath.
MYELIN sheath.
Does
And you
that have to
said
do with MS?
Does.
or Parkinson's?
Yeah. So what's happening is as this information is going along, that little cable, because let's pretend our brain is a train because it rhymes and it makes sense, right? So we're going down the train, and as we're going through, that cable is getting a little bit broken down, that wire, right? So eventually what happens?
Oh, misfiring.
It derails, it misfires, yeah. So then you have cognitive issues, you have musculoskeletal issues, right? So the hack for understanding this is they always use the key code myelin sheath. And what does multiple sclerosis starting in with?
MS?
What is myelin sheath? Oh my gosh, she did it again. Yeah, I did. A gift for you and you and you. Hi, come on.
Sheath.
Find your hack, just like I do, and then it's fun and it's easy. It's easy to remember these things. All right, so let's talk autoimmune diseases. What autoimmune disease is going to cause crippling pain in my joints? In my tissue?
Rheumatoid arthritis.
Arthritis?
Yes, yes, it's terrible. It literally creates curvature in your fingers as you age. It's awful. Now, if I had a massive amount of pain in my wrist because I work in a factory opening jars all the time for 12 hours.
Carpal tunnel.
Oh, perfect. Perfect. Okay. I'm going to give you some acronyms again. What is an MDI?
MDI.
Meter dose.
All the people.
What?
What is it?
Meter
Dose inhaler.
Yes, give me an example of such.
Like a spacer for albuterol treatment.
Yes, albuterol. Beautiful, beautiful. All right. let's get into a little more immunology because we were talking about autoimmune diseases. Give me another autoimmune disorder that is a result of exposure.
HIV.
HIV.
Okay. And what's its even sadder counterpart?
AIDS.
AIDS is transforms into AIDS if left untreated.
So what do they both stand for?
Human
And deficiencies syndrome, acquired immune deficiency syndrome.
Very good. And does anybody know, as a bonus item, what specific chemistry we look at? Specifically,
CD4.
RNA, DNA.
CD4 count.
I mean CD4, T4 cell. Yeah.
beautiful, beautiful. Good job. God, you guys are so smart. I'm so proud. So proud. Just, you make me proud. It's nice to know that you guys are really doing great. I'm really excited. All right. Sorry, tomorrow's going to be a rough day. Everyone knows. Let's go back to cardiac, okay? Sorry. All right, going back to cardiac. Tell me, when I'm doing lab or blood panels, what is the most important one that I need to get specific to someone at risk for coronary artery disease?
Potassium
Cholesterol.
or
Cholesterol.
cholesterol.
Cholesterol. For coronary artery disease, cholesterol. For congestive heart failure, different story, right?
Oh, yeah, because if they're
Oh my God.
paying endemics, you're going to be paying attention to the potassium.
Yeah. So we're going to look at all those other panels over there because we're more concerned about what's happening with the kidneys. Okay, perfect. You're right on point for next semester. I'm proud of you. All right. So what is the scary one for my cholesterols? What is the not scary one? And what's the hack I taught you?
HDL is healthy, and I think you said
LDL.
lethal is LDL.
Very good. Very good. Does anyone happen to know what the numbers look like for those parameters?
LDLs you want below 70.
Okay. Anyone else?
HDL, anything above 60 is good.
Okay. And we're confident on both of those numbers.
Something's jumping at my head for LDLs like 100, but
There you There you
Is it
go.
100?
There you go. There you go.
Yeah.
There you go. Good job. All right. Now let's talk congestive heart failure. Let's talk left-sided versus right-sided. What's the difference between my presentation on my patient with left-sided heart failure that is totally different than right-sided heart failure? Remember
Would
the
it be
left means what? Come on. Left lung. Okay.
fluid in the lungs?
Yes, thank you.
And then right would be fluid everywhere else in the interstitials. Yeah.
Yes. So I get the JVB, the hepatojocular reflex, like the big nasty bulging, right? I get a big fat face, and then I get fat arms, and I get fat legs, and fat feet.
Lymphedema.
Yeah. So that's all right side. That's after we have filled the reservoir, and I'm pressing on, like I'm touching left lung for a reason, because I'm trying to get you to think left lung, right? So I'm hearing all of this, and it sounds like bubbling in chocolate milk, right? And after it pushes all that out, then it starts going everywhere else because there's nowhere else for it to go. It's a way of preserving life, right? It's a defense mechanism. All right. We are almost done. Now, tell me about a person who has congestive heart failure on the left side, and their saturation is a little low, and they are darker skinned. How can I tell if they are losing oxygen?
Cyanosis.
Check for cyanosis on someone who's darker skinned? Where would I look?
Action inside the cheek, the buccal.
in their mouth.
Yeah.
Yes, buccal mucosa inside of it. It's going to look different. We're going to find the presence of pallor. It's going to be like a grayish whitish, right? That's kind of what pallor looks like. Sometimes it's a tingy blue, right? But more of a silver. But it's kind of a different color and a different shade than you would expect, which is why we check it. Okay, good job.
Buccal mucosa.
Now, let's go back to the gal who had rheumatoid arthritis really bad. Okay. A person with rheumatoid arthritis has a long history of taking steroids. What do steroids cause when used over a long period of time?
High blood pressure.
Elevated
tachycardia.
sugar and high blood.
There's a bigger one. She's a lady. She's old.
Oh, it's going to be
Osteoporosis. How do we know?
Parkinson.
What is a question that we can ask them as a patient to see if they are at a higher risk for osteoporosis?
Do you drink milk
They
every
drink
day?
milk daily.
Oh my gosh, that's so smart and so easy, because you know what? Nursing's common sense and you guys got it all. All right. Tell me what the word tympani means to you.
timpani. It means lungs. No, sound.
What are we? Yeah, sound, percussion, right?
Yeah, lung sounds.
Timpani. So we listen for timpani when we're going over certain organs. What would be a good organ to percuss and listen for timpani?
Your lungs.
Can we though? Because the ribs.
Well, no, yeah. The abdominal, like
Like the what?
the quadrants, the 4 quadrants.
Oh, can we do it with the stomach?
The liver.
How is the liver going to sound? What's the expectation?
Blah, blah, blah.
Is it going to sound heavy or is it going to sound light and airy?
Heavy.
It's heavy. Have you ever held a liver before? Yikes. She goes plop. I mean, it's a sound that you don't forget. It's a really kind of funny sound. All right. So it's really heavy. It's really dense. So if I smacked on it, I would not expect to hear light and airy. Okay. Where would I hear something light and airy though?
Gallbladder.
Well, no, because it's too tiny. And also,
Kidneys.
okay, those are pretty heavy too. What about something that like
Spleen.
something that expands and contracts at the regular? Could be
Your
empty,
lung.
could be full. It's in the abdomen. Come on.
The diaphragm.
Above.
Heart.
What?
Sorry.
Get out of the rib cage. What are we doing here? The stomach. The stomach expands and contracts regularly because you either eat a lot or you don't eat at all. So that's a good point of contingency for hearing something light and airy, right? Does that make sense? Did I explain that well? I'm not being funny. I'm being serious.
Like if somebody was like malnourished or
Yeah, I mean, if I'm percussing, right? I'm listening for sounds. I would expect that the stomach is going to give me potential tympani, even if they ate. I wouldn't expect it to be so taut unless something is wrong, because I would listen for light and airy sounds because it's the stomach. So it bounces as I bounce it. Does that make sense?
Yes.
Percussion always confuses people. That's why I like to go over it quite a bit. Because it's just such a weird thing to do. And it's such an ancient practice, quite literally. But I like to give it a little bit more clout than we've always given it in regular nursing curriculum because it's something we can use very productively, I might add. If I were to tell you I were testing visual acuity in a person, what tests would I be administering?
Can you repeat
Snellen chart.
or
Snellen chart.
Snellen?
Good. Now, if I were a patient who was very well aged, and I didn't hear so well, how would you speak to me?
In front of you.
In front of you, deep, low,
Tell me
slow
about the
tone.
volume.
Normal voice tone. Unless they really can't hear, then you gotta increase your voice.
Okay,
Normal
good,
voice in a low tone.
perfect. Okay. Now, we have to get a little bit into reproductive because reproductive was covered. So if I hear that I'm getting a person who's coming up to my unit and they are 42 years old, what would be an appropriate question that I need to ask them to make sure that all bases are covered in the event of an uh-oh?
When was your last menstrual cycle?
My gosh, perfect. And what is another follow-up question I need to ask if they don't quite understand what that means?
When was the last time you had your period?
Thank you. Do you experience missed periods?
Are
Okay.
they irregular?
Hi, these are questions that we ask because we need to screen for a couple of things, right? Perfect. I love that. All right. Remember, our math is going to be the same math as it always is, same as it ever was, same as it always will be. Do you guys have any questions whatsoever?
No.
Okay. I hope you guys have a good day tomorrow. I'm going to be gone for some labs and I'll be back around 5 o'clock. I'm going to try to get there a little bit earlier if I can, but nothing can be promised with how tomorrow's going to go. Know that I love you, all of you, and I'm proud of all of you in very different ways, which means more to me. But it's not just one standard practice of love for all of you. It's different and it's real. And you got one person in this world that will support you, but you have to let me know what's going on.
Love you too.
Just know that you guys are protected, but you got to tell me. Okay? And know that I'll be there the second you do. And I'm so proud of you all. So let's go to sleep because
Don't do that.
Good.
It's gonna be, why are you doing
I had
that?
an eyelash up in my eye, and you know this glue don't last like it needs to. So why don't you calm your little self down and y'all go to bed? Okay.
Okay, well, drive safe.
See you
Okay.
tomorrow. Bye, guys.
Good night. Thank you.
Thank you. Have a wonderful
so much.
night.
You too. Bye.